Working Like Tomorrow really speaks to just our organization philosophy is we're just continuous improvement and always looking to solve our future problems as fast as we possibly can and in the right manner possible. And so you pull forward problems or workflows that are taking too much time and be able to complete those so that we can move on to more complex problems and advance our mission in the organization and the community.
My name is Rob Duber. I'm the manager of process automation here at University Hospitals. Started using Kofax products through accounts payable automation. And then I've transitioned into using the RPA suite of products to use robotic process automation here at UH.
I'm Jeff Lubbe. I'm the corporate finance director at University Hospitals. Part of my responsibilities involve the accounts payable shared service center. A little bit about University Hospitals. We're located in Northeast Ohio. We're about a $4.5 billion organization. We have a full range of services throughout the area. We have about 2,200 physicians serving primarily just the Northeast Ohio area, and it's services from pediatric services through final stage services. We're in healthcare, and it's an industry that is very diverse in nature. You have hospital locations all over. You have doctor offices all over the area, and it's trying to get the technology in place to make sure you don't have to pass any paper around through all those organizations. One of the challenges we have is that because we're involved in a lot of clinical operations, they want to have the back office end of it as streamlined as possible so they can really concentrate on patient care.
In late 2020, our central COVID response team came to us with a problem where there was an exceptional amount of manual work that was being done by registered nurses in that group. Over the course of 1 to 2 months, we implemented some robotic process automation to free up a really important time. We were experiencing our second wave of infection and beginning our immunization program. And we really needed that team to focus on clinical type issues rather than simple manual work. And so we took the manual work that they were required to do down completely and then saved about 5 FTEs in the process from really day one. And they were able to redirect their resources to focus on our vaccination program. We processed a little over 57,000 orders through automation to allow nurses to be nurses instead of data entry clerks. The RPA platform works very hard in the middle of the night so that when the clinicians arrive in the morning and they used to have 500 or 600 transactions in their queue to process, now they have 20. We were able to go to bed knowing that we've redeployed clinical staff to focus on clinical things. The AT solution offers a lot of variability in how we can extend the product to meet our approval requirements. And that's been really effective to really manage the different cycle times within the invoice workflow process.
We've acquired 5 different hospitals in the last 5 years. We've converted those all over our systems, and we've been able to leverage those transitions and because of the scalability of the system. We can take on huge organization and an acquisition and very quickly transition them to automated workflows. Just look at our response to COVID. We had full availability to have everybody work remotely because we could tap into the automated workflows and the whole accounts payable department. The only person that had to come in is the one who actually printed off checks. I couldn't move the check printer to his home.
And I think another key element of the AT solution specifically is when we onboard these new organizations, it's an intuitive workflow. The tools that Kofax has set forth, it doesn't require significant amounts of training or ramp up time. It's just really an intuitive platform that teams can leverage quickly. Our Center of Excellence is missioned with creating value and reducing friction within the organization. And so one of the things that we're constantly tracking real time is the value that we're creating for the organization. To date, we've processed just about 1.3 million transactions since 2019. We're saving about 20 FTEs per day of manual labor. And later this month, we'll eclipse the $1 million save mark, something that we're really proud of.
What we're trying to do is free up analytical time across the board. We need to have people that can be thinking rather than just sitting down and keying in transactions.
What we've turned our staff into is instead of manual transaction processors, we're exception processors and problem solvers. And that just speaks to really upskilling the labor force and creating a higher quality staff. As healthcare is evolving, and particularly with COVID as well, one of our organization initiatives is really to keep our patients healthy at home. And so we've been involved over the last few months, and we'll continue to be involved on helping our home care team become more efficient through automation.